Greetings and salutations. Thank you for joining us on this webinar. As aptly said by Fatima, this is definitely one that is timely, especially on this International Women's Day, whose theme is actually celebrating women in leadership and ensuring that we let go of any biases and inequalities, especially in the face of COVID-19. Well, thank you again for joining us. As Fatima mentioned that for any of your questions or your comments, you can send that to connecting@webinars@aku.edu. That is connecting.webinars@aku.edu. So let me introduce our panelists. Again, as you can see, these amazing ladies who are joining us this afternoon. They are all doctors. So this is the part where I say that I'm basking in the presence of doctors, but also influencers, change agents, and we celebrate you this International Women's Day. So let's get off to the questions now that we have the names right. Now, let me start off with Dr. Chege. Can you allow me to call you Njoki now that we know each other beyond this?
Absolutely, Gladys. Go ahead and call
All right, excellent. So Njoki, traditionally, the innovation space is a male-dominated, and at the same time, you are leading the Innovation Center at the Graduate School of Media and Communication. How are you navigating this space, and how can more opportunities be created for women in Kenya and, of course, the broader East Africa?
Thank you very much, Gladys, and thank you to Fatima and everyone else joining us from different parts of the world. You're right, the world of innovation is quite male-dominated, although going forward, I think I will tell you my problem with that word male-dominated, but that's a story for another time. So it is true that this is quote-unquote a man's world. But we are trying to include more women, particularly from Kenya, Uganda, and Tanzania, to join us in this innovation push for media viability across Africa. So, I mean, out of all the 5 teams that we currently have as innovators in residence, 3 are actually led by women. So we have 3 female founders out of the 5 teams that we are supporting, so which is good for us. But really, how do we create more opportunities for women? I think we need to be intentional. When we do this calls for applications and all that, we need to ensure that women see these opportunities and that women apply. I don't think there's any other way. The other thing, we also need to sensitize women on opportunities of digital media. Now, Gladys, you and I are in a very interesting media industry, and we also happen to be in a very interesting time where we have been disrupted by the digital technologies. But in this disruption, there's also a lot of opportunity. And we need women, particularly women founders, to be aware of these opportunities that are accorded to us by the digital disruption. And also talking at a global level, particularly in this era of COVID, I am now convinced that we will never have a post-COVID era. I have just given up. So I think even with COVID, there's so many opportunities in the innovation space. I mean, our work situations have been disrupted. I'm sure Eunice, speaking from a nursing perspective, it has also been disrupted. So I think the main issue here is to sensitize women on the opportunities and support them in the best way we can, whether it is through mentorship, whether it is through training, or even coaching like we do. I think the key area is to be intentional in everything that we do.
Okay, and I hear you loud and clear, Njoki. Clearly, innovation is the future, and it's not only the future, it is the reality for us, and especially in this hashtag new normal that we're seeing ourselves in this pandemic. And perhaps something else that you haven't mentioned, but stands, at the top of the list in terms of the obstacles for women to get into the innovation space: funding. Many shy away because they feel they are not, aptly equipped to fund some of their innovative ideas. How can we edge them on?
Well, that's a really good question. Many women don't put themselves out there, but I think what we need to do, well, there could be the issue of affirmative action. And ensuring that out of X number of people that we fund, we have X number of slots for women. I think that will really work. But really, I think the most important thing is to sensitize women and tell them that there's a huge need for you to put yourself out there, to put your business opportunities out there, your startups, your ideas and all that. Because what we see, I think in many cases, even with scholarships and everything, people will tell you, but women don't apply, even with these big jobs and even in politics, in business and everything. So I think the key is to encourage women to apply, and also have special slots for them. In the cases where you might not find a lot of women applying, such as funding and all that.
Okay, and coming from a teacher's point of view, of course, as a lecturer and somebody who imparts knowledge, there has also been the concern of lack of business acumen. People who understand how the business is done, what it takes, and you will find that men are said to be more risk, they can take up risks, and women are more risk averse. How can we ensure that we encourage more women into this space and give them the tools that they need to thrive?
Well, that's a good question. So what we've been doing at a media for innovation perspective is doing tailor-made training. So we do a tailor-made training for a particular startup. And I think we can apply the same concept for women. Some of the businesses and the small media startups that we support, we see that they're really good journalists. They are fantastic storytellers, but they don't have that business acumen. It doesn't matter if you're male or female. So what we do, we ensure that we tailor-made that training to your needs. And I think the same concept applies, that if we have a section of women who particularly do not have that business acumen, which I doubt, because I think business acumen is not gender specific. But if we find that they have that particular need, then the key thing is to ensure that we have tailor-made training, coaching, and mentorship for those female founders. Thank you, Gladys.
Well said. So just in case you're wondering, that is Dr. Chege. She's the Director Innovation Center at the Graduate School of Media and Communications at the Agakhan University. The Innovation Center is aimed at enhancing media viability in East Africa. Based in Nairobi, the center provides training, coaching, and mentorship to media innovators in Kenya, Uganda, and Tanzania. And of course, Dr. Chege has 9 years experience in the media as a journalist, columnist, and also an editor. And this is the part where I say, I know you, Dr. Chege, tumetoka mbali.
Indeed.
All right, so over to the health matters, and this is where it hits home, especially in the face of a pandemic. And let's bring in Dr. Eunice Ndirangu. And this is where we are all trying to figure out the role of healthcare practitioners has definitely been illuminated in the pandemic. So how have you seen the role of women change over the years in the nursing profession particularly, and how are you leading to ensure that women are more empowered and have a voice?
Thank you, Gladys and Fatima and everybody else for this opportunity. It's interesting that in the nursing profession, we have the opposite problem that Dr. Njoki has in her innovation space. The nursing profession is very female dominated. Actually, in some countries, as high as 90% of nurses are actually female. In our country, it's about 70 to 75%. So essentially what happens in the nursing profession is that you find the gender inequalities that we see within society are very, very much reflected in the nursing profession. And, last year being the year of the nurse and midwife, the World Health Organization and International Council of Nurses did a report looking at the role of gender and how nursing being a gendered profession has affected the progress of the profession. And the reality is, when you look at it right now, nurses rarely get leadership positions, rarely get involved in decision making, rarely get involved in policy. I mean, the other day we're having conversations about the COVID vaccine, for instance. There hasn't been nothing on the table, but 80 to 90% of the vaccinators are going to be nurses. So that has really been the biggest challenge within the profession. And so when we look at it, we have to think about what do we need to empower the nurse, because by empowering nurses, we're actually empowering a really big population of the female gender for women in this country. So what is it that AKU is doing? What is it that I am doing? I'll start with what AKU is doing. Looking at our own programs right now, we spend a lot of time getting support and funding so that we're able to provide quality education for nurses, who the majority of whom are female. And you'll find that about a third of our classes are male and the rest are female. The other thing also is we've seen a lot that when women have money, they tend to spend that money within the family. So their first priority is to feed the children, pay school fees, and so on. So they leave very little for themselves and for their own self-growth. And we do know there's a direct relationship between the level of education and access to education and how well then you'd go on to do in life, right? So getting nurses support so that they're able to get an education means they can do what they need to do in their homes, in their families, and then through the support of funding, then they can get access to that education. But there's something I find quite interesting in my view is how we train. And you talked earlier about training when you were speaking with Njoki. We need to rethink about training. And what I have found, if we focus a lot in building certain skills around leadership, besides teaching people how to be an amazing nurse, teaching them those leadership skills, teaching them problem solving, confidence even, it goes a long way in getting them to that space where they're able to do very well. We've seen among our own students, people going on to be CEOs and chief nursing officers and so on. But here's the thing, we always imagine that innovation is not part of that process. I was talking to somebody the other day and I said, if you give a woman today 200 shillings, she'll feed a family. Innovation right there. So they are inherently innovators. What we really need to do right now, Gladys, is to think about getting it into their mind, reminding them, nurturing it when they come to us. Then it becomes a lot easier for them to get into any space, whether it's in the healthcare, whether it's in the digital space, and going on out there to ensure that at least they are problem solving and they're actually able to come up with innovation to the challenges that we face. Thank you.
Interesting perspectives there. And I'm just wondering, especially now in Kenya, that we are really looking into the next phase of rolling out or fully rolling out the universal health coverage. What do you think would be the impact on the rollout of such, of the UHC? Would this now ensure that the nurses across board are given an opportunity to step up and perhaps even get the opportunities to lead their cohorts?
Well, interestingly enough, nurses are doing that. Right now, about 80% of anybody who gets access from a trained healthcare profession, chances are that healthcare profession happens to be a nurse because they are in the grassroots. They're in your community, they're in your health centers. What has not happened actually is ensuring that there's that recognition for it, but also that you have a good system that shows you how you connect the person at the community level and the various levels of health service. So there is no way you can talk about universal health coverage without talking about nursing. And I always indicate that we have to build a profession, we have to train, we have to empower. We have to also provide the resources for them to be able to ensure that universal health coverage is a reality. So yeah, there's no two ways around getting UHC happening. It has to happen through getting sure that we are building nurses. And one of the things we've tried to do, for instance, at Sonam is to roll out an advanced nursing practice master's, because then you get a graduate who can go to the public or the primary healthcare setting and actually be able to provide the care that they can provide and refer accordingly should the need arise.
Okay, I think at this point, it would be important to reiterate the importance of a nurse, and especially now that this has been underscored by this pandemic. Perhaps just tell us what it is that a nurse brings to the table and why the healthcare system cannot do without them.
So when you look at nursing as a profession, one, the obvious one is that the majority of the providers are actually nurses. The second point always is how we look at healthcare and how we deal with healthcare issues is also quite unique, because we are made to come from the perspective of preventive medicine, looking at how you prevent illness, looking at how you take care of a person as a whole. So thinking about holistic care, thinking about how do you then identify issues that a patient may have or that a family may have, and how do you then provide the relevant education that they need to maintain and promote their health, but also the linkage that comes with the other healthcare professions. So your nurse becomes a center in an inter or a multidisciplinary team. So you have your doctor, your physician, and so on in that team. The nurse is at the center of that. That's a person who spends, what, 24 hours with a patient? I know Dr. Hilda will smile at this, and makes sure that the patient is fine, right? So there's no way we can remove the nurse from that equation, whichever way we look at it. And for me, the call here is to ensure that whether it's in leadership, whether it's in policy, whether it is in training, whether it's in opportunities to make a change, that actually the nurses are put at the center of that.
All right, very well said. Dr. Eunice Ndirangu, again, she's the chairperson of the Nursing Council of Kenya. That's why she speaks with so much authority and experience. She's an associate professor and the dean of the Agakhan University School of Nursing and Midwifery, and of course, East Africa. And she has also worked as the academic head since 2016 before becoming the interim dean on March the 18th, 2019 at the same institutions. Now, still staying on the health matters now that we're bringing in Dr. Hilda and Nabiswa. But then again, the question to you is, you have been trained and given the powers to go and read and impart knowledge on others. In what ways has your Agakhan University education changed your life as a woman?
That's an interesting question. And I honestly believe that Agakhan made me a much different person. And one of the ways that it actually really changed my life is that it demystified what a successful doctor, female doctor is. You know, sometimes we look at these big doctors, you know, who own hospitals. We talk about the Dr. Betty Gikonyo, for example, in Karen Hospital, and you look at them and you think they're, you know, unapproachable and you can't really even get close to them. But my learning experience in Agakhan actually made me realize that it's possible to do this. It really demystified the whole aspect of how to be a successful woman, because I could see how the doctors there were relating with us, how successful they were, and yet how humble they were at the same time. And it made them look more human. And at that point, that's the time I realized that, you know what, I can do this as well. And it really instilled in me a sense of whatever seed that they have planted in me, I hope to plant that same seed in someone else, because somewhere out there, there's a certain young girl maybe who's looking at me and thinking the same about me and thinking, hey, that's a physician, a big doctor. But I know that it's just, we are just the same. All it takes is just to have mentorship, to make sure that we instill those same values that were instilled in us by those senior female doctors into them, so that they can believe in themselves. And I really like what Njoki said, that women don't apply for these positions because they just don't feel confident. And what Agakhan instilled in me was confidence. A lot of people to partake in different aspects of my field without feeling intimidated. I remember the first time after graduation, I actually went to Turkana, and I was there for around 8 months. And everyone was wondering, how is this young girl going to Turkana? You know, but I was confident. I knew that I had what it takes, and I knew I'm a physician, I'm a doctor, and I can treat the people there. And there was really nothing that held me back there. And thereafter, I've also gone to Chogoria Hospital, which is not in the city. It's still also a rural hospital, but I still feel comfortable and confident when I take care of the patients there. So I believe the confidence that I got from the university has taken, it has taken me really far with my career. And the other thing that I learned as well with time, Dr. Eunice has talked about how nurses are traditionally female. Now, on the other end, you can imagine doctors are traditionally male. So I can't tell you how many times I'm conducting a ward round and the patients and the relatives call me nurse, because that's what they believe, you know. With time you get used to it, but it also inspires me so that I can be able to show young ladies and people who aspire to be doctors in future that you can still do it. Let's not think of this as a male-dominated field. Anyone can prosper in this field. And I think everyone has got what it takes, whether they're male or female. And even though females, actually nowadays in medical schools, females are majority in terms of, in terms of like in medical school, around 60% are female now, not male. So things are changing. I think with time, as times change, people realize that, you know, anyone, it doesn't matter whether you're male or female, we can do all these things just the same way. And perhaps even better, I would think so. Perhaps better, because there's a certain thing that a woman brings into the equation that is quite special.
All right. And even as we are talking about the importance of mentorship, I think on a personal level, opportunity is also important, but also when you're given that opportunity, you've got to make the best out of it. Let's talk about intentionality when it comes to upskilling. So you have this opportunity, you've been given the right to go and impart knowledge, heal other people, but what do you do beyond that to ensure that you not only sustain your trade, but also go up that ladder, Dr.
Yeah, so that's a good question. And one of the ways to do it is by planting seeds and watering them and watching those seeds grow into trees. And what I mean is many times, for example, in my position as a physician, I interact with interns, I interact with medical officers, and I try as much as possible to impart and try and, give them this sense of confidence in themselves and knowing that they can be more than just what they are right now. And I regularly talk to them, you know, try and nurture them just the way I was nurtured. It's kind of like a process, you know. Whatever was done to me by my seniors in Agakhan is the same thing I will impart to the juniors that I face right now. And having regular meetings with them, talking to them about their career choices early enough so that they can be able to grow with time. A number of people have actually joined the Agakhan program just after talking to me and finding out how the program is. And they were inspired and said, you know, let me give it a try. So I would say that it goes beyond just going and taking care of the patient. There's also that aspect of knowing that people are looking up to you and you have to really take up that role seriously and make sure that I try to make sure that I mentor as many people as I can under my wing, the ones who are willing to come through, especially in internal medicine. I'm really passionate about that.
Okay, clearly from Dr. Nabiswa, when you educate a girl or a woman, you educate a village, literally. And that is what she's taken up as her mantle. She is a consultant physician, internal medicine at the PCH Ogoria Hospital. She's an experienced physician with a demonstrated history of working in the hospital and healthcare industry. And she is passionate and strong about healthcare services and skilled in healthcare consulting, epidemiology, medicine, prevention, and infectious diseases. So even as we talk about this and perhaps just tying it to the theme of the day, and women in both urban and rural settings are leaders at home or at work, whichever part of community, a woman will always lead in one way or another. But at the same time, there are still fewer women in professional leadership positions across board. So what can be challenged now that we are choosing to challenge? What can be challenged, whether in the environmental, cultural, social, economic, educational, politically? What changes need to be put in place in order to increase women's participation in the workforce and more so in the leadership roles? Let me start off with Njoki.
Thank you. That's a great question, Gladys. I think it's a good time to start looking at some statistics. So 57 out of the 193 countries that are members of the United Nations have had female leaders, only 57 out of 193. So which means that 70% of the world's total nations have never had a female leader. If you include the number of nations that have had a female leader as an interim, acting, temporary, then that number shifts from 57, you go to 72. So which means that 60% of the world's nations have never ever had a female leader, even as a temporary. So which is actually quite shocking. And when you see some of these gaps at the political level, they trickle down at the economic level, at the social level, and even at the educational level. And I think it's time for us to challenge these kinds of gender parities, whether political or economic. For example, I think based on statistics from the World Economic Forum, for every dollar a man earns, a woman earns 63 cents. And that is as recent as last year in 2020. So these gender gaps need to continually be challenged. And I think we also need to, first of all, to include women at that grassroots level. In most countries, politically, you cannot be a prime minister if you have not been an MP. Unless it's the Westminster kind of government like the UK, but for most countries, you cannot be a national leader unless you are a grassroots leader. But women are not included at leadership levels at the grassroots. They're just included as, you know, mobilizers. They mobilize people to vote for the man, and then they miss out at the decision-making table. So because women miss out at the decision-making table, they are in the yard taking the consequences of the decisions that have been made at the table. So I think we need to encourage more women. It still goes back to what I said earlier. We need to encourage more women to stand up and to lean in. Yeah, let me use that modern term, to sort of lean in and raise their hands. When it comes to leadership positions, don't be don't be intimidated by the political situation or the fact that people, naturally don't like women leaders. I think it's for women to put themselves out there, but also what is more important is that perhaps it's also time for us as a society to man up. And by this, I mean including men in these kinds of conversations. I just wish we had a man in the panel. I know it's International Women's Day, but we cannot close this gender gap without the assistance of men. I mean, for everyone, every woman who has had, has made serious steps in their careers, there was a man who gave them an opportunity, whether it was your father who took you to school, or an uncle, yeah, or even a boss, somebody who gave you an opportunity. So we cannot win this fight if we do not include the other half of the population, and that is the men. Thank you, Gladys.
Okay, so I'll start off with Dr. Ndirangu. I mean, the COVID-19 pandemic has amplified the various inequalities that women face in your profession, or even broader. What do you think needs to be challenged to give an equal chance to the women?
Thanks, Gladys. I have a lot of things that I think could be challenged, but I think the first thing we need to agree is that women really bore the brunt when it came to COVID-19, whether it's through job losses, whether it's through the mental pressures that came with having to deal with children at home 24/7. I am sure I'm speaking for many when we said, I think now schools need to be reopened because, we were just until here. But I think the first thing we need to really challenge, and to me, this is an appreciation that differences actually exist. I find that whenever we start from a point of imagining we are all at equal footing, that is where the problems start. I think we need to appreciate that differences exist, both socially, environmentally, dare I say even biologically. If I reflect back, even when opportunities are presented, sometimes those differences make it difficult for you to say yes. I remember when I was offered 2 years back to take on the role of interim dean and hold the fort, my default answer was no. Why? I had a 2-month-old baby who was still nursing. I had not put him on a bottle. And I was like, okay, this is not something I can do. So in as much as I got the opportunity, the institution was ready for me to take on that chance. Other parameters made it difficult. And so my line manager, God bless his heart, ended up making a number of concessions for me to be able to take up that role. And that's how I was able to, actually deliver in the end. So I think that's where we need to start. And the challenge for me would be for those who are in leadership, for those who are in any position, to think about those distinctions that come. And rather than ignore them and say they have level playing field, to remember that they actually do affect. I think the other thing I'll choose to challenge is how we bring up girls. I'm a mother of 2 girls and 1 boy, and I would like to say that in the end, we need to remind girls that it's okay to shine, it's okay to be the brightest, it's okay to be the smartest in a group or in a class. We need to make girls and women more comfortable with their brilliance, because often what do? We downplay it, we hide it under the carpet, we make ourselves look less than our male counterpart, because that's how the culture and society kind of makes us think and feel that is normal. But the thing I think of is, because of that, a woman does not get born, or a girl doesn't come into the world deciding to be a leader. It is something that comes by us, because then that's not how we are cultured. So that's the other thing I would like to challenge. The challenge that we look at everyone based on their abilities of leadership. That should be the lens that we use, not the gender lens. The other thing I would like to challenge is the attributes that we believe a good leader has. You see, I'm a woman, I am compassionate, that's my nature. I am empathetic, that's what I do. I care, that's just who I am. But we grow up thinking that we have to change that for us to be seen as good leaders, but then it's who we are. My challenge today is that actually, I believe that's what makes women brilliant leaders. And I think COVID-19 has showed us very well that this is actually a fact. Many people in our teams had issues. Many people in our teams had concerns. If we were not alive to those concerns, if I wasn't conscious of those concerns, then what kind of a leader would that make me? So that would be my third challenge. The fourth one, Njoki has talked about, which is getting men to take on certain tasks. If my son is sick today and we're in the ward, we are going to be female leaders and women admitted with our children. Can men take on a little bit of more of these roles? Because then, it just helps in terms of getting on and growing up the career ladder. Thank you, Gladys.
All right. And speaking of challenges, Dr. Nabiswa, what are some of the greatest challenges perhaps facing civil society institutions? And this includes the Agakhan University going forward, especially with the pandemic.
Well, the pandemic it took us all by surprise, and it taught us a lot. One of the main challenges I have seen that women face in this pandemic, generally, not even going to Agakhan, is I have seen female caregivers who are treating COVID patients generally have, they feel like they have more to lose than their male counterparts. The reason I'm saying that is I have had nurses who are breastfeeding their children, for example, and they have to come to work. I've had, people who are as a woman, you're kind of the nerve of the family. So everyone comes to you. And so you have these caregivers who are in the midst of the pandemic, working with COVID patients, and they go home and they have no idea how they're going to deal with all this. The children are running to them, they need to breastfeed, they need to, deal with the small babies. It's been quite challenging for them. And I think it is one of those things that makes it a bit difficult when you're a woman. It's very challenging when you're dealt with a hard blow like COVID-19. You still have to do your job, but you still have so many other things to think about. And it has been quite challenging for a few of the people I work with. I have seen, personally, I've seen a number of people infected with the disease, and it has really been difficult for them. They couldn't really interact with their families, especially at the beginning. They couldn't interact with their families the way they needed to, and it was quite difficult. So it's when it comes to the civic duties that, for example, an institution like Agakhan would do, I think one of them is to just be the voice. Let us acknowledge the challenges that people are facing. It's important for us to have a feel of what people are going through, the healthcare providers especially, and the women who have been directly affected by COVID-19. I think it would be lovely, for example, from people who have, like you yourself and Dr. Njoki, Chege, who the media, you have a great tool. We can use it to kind of tell people's stories, whether it is the healthcare provider story, whether it is a woman who has been affected by COVID-19 directly. I think we owe the country and literally the world just people's stories to have a feel of what are the personal stories that people are going through with COVID-19. And maybe that will help us to now create awareness as to what are the gaps that are there. What can we do better? Is there a way maybe we can make it better for a working mother who has breastfeeding babies and is working at the hospital, access their children in this COVID-19 pandemic? We can find answers to questions that we will identify through those gaps. So I think we should use the resources around us. Let us, especially media being a very big tool, and that Agakhan has as well, I think it would go a long way. Let us, the healthcare providers, let us hear the stories of the people who've been affected directly, infected, and so from there we can learn, and then from there we can
That's
also—
a great challenge. We take
know
it up, and let me throw it at Njoki at this point. As much as we're seeing the challenges, and of course we're talking about the possibilities of how we can move on and be able to get the best out of this dilemma, what are the opportunities? What's the silver lining in this pandemic that women can actually ride on?
Thank you, Gladys, for that question. So I think some of the opportunities that I see, obviously, I'm sitting from an innovation space, is that obviously we were not prepared for the pandemic, and the pandemic has affected each and every sector and industry in different ways. And I think this is an opportunity for women to come up with solutions and also to think differently. So I'm speaking from a media perspective. We've seen people tinkering with different storytelling methods and all that. And it really pleases my heart, and it encourages me a lot when I see women going out there applying for our residency program, and they want to do different kinds of storytelling because they have realized that the media was not just disrupted earlier on by digital media, but also disrupted by COVID-19. So I think, and this is a challenge that I want to throw to all women, whatever gap that you have identified in your industry, do you want to seek and to be the person that comes up with a solution? And I think that is the essence of innovation. Where we see, where other people see challenges, we actually see an opportunity. Thank you, Gladys.
Okay, and how about Dr. Ndirangu? How do you see possibilities emerging from this pandemic, especially the healthcare sector?
I would say in two areas. One is physical and mental support for frontline workers. If there's something we've learned from COVID, is that mental health is a priority. It's not to say that mental health challenges were not there before. They were there before. The only difference is because COVID then brought in additional pressures, we've now become more aware of this. And I think that's one of the key areas for me that I would say is something that needs to start and continue even post-COVID. The other thing for me would be increased investment in nursing education. If we look at it, and we've said this earlier, girls often will not get an opportunity to get an education, especially if they're from rural and hard to reach areas. So getting donors and funders to actually get us to get opportunities to pay and support young girls and women who want to upgrade their education so that they are able to increase their level of education and therefore continuously improve their own social and economic well-being would be the other one for me as well.
Very well said. Now, at this point, I just remind all the participants in this webinar that you can be part of it by sending your comment or your questions to connecting.webinars@aku.edu. That is connecting.webinars@aku.edu, and we shall be addressing them in a moment, even as we wind up this conversation. And ladies, you are all connected to the Agakhan University professionally and academically. In what ways do you feel that the university promotes women and empowers them in East Africa? Let's start off with Dr. Nabiswa.
So having been a direct recipient of a scholarship, I think that is one of the things. I mean, when I finished my medical education, my first degree, I didn't know how I was going to finance my master's. And so getting a scholarship through the Agakhan Foundation in itself has really propelled my career and has helped me grow from, in leaps and bounds, to be honest. The other way in which it helps women to grow, and I will say it, I will use one of my close friends as an example, is my friend was actually able to get 2 babies while still doing the program. So it actually makes you realize that you're still a woman. I mean, you can still have your children and still go for what you want in education. And I think that's an amazing thing. that you can grow in all areas, all aspects of your womanhood, whether it's being a mother, being a doctor, and that to me is really amazing.
Dr. Ndirangu.
I'm actually smiling as Dr. Hilda was speaking. Yeah, I think for me that's one. As an employee of AKU, the fact that whatever my social circumstances were did not in any way stop me from getting an opportunity to lead is for me a plus. The fact that the institution gives the roles based on merit rather than anything else beyond that, to me, is another plus. Another element to this is creating a safe work environment. I mean, for women, safety, and I don't mean just safety of anything else, but I mean the social environment that is culturally safe for you, that's not abrasive, that takes care of your own physical and social well-being, to me is critical, because then how do you thrive any other way? And this is usually something important for women. So those three things for me are what I would say AKU has been good at doing. Thank you.
Okay, Njoki, you are the journalist that moved on into academia and now you are imparting knowledge to others. What is the impact of working with Agakhan University?
Yeah, so I think the most critical thing for me is the fact that Agakhan has the reputation of taking chances in young female leaders. I think that's a really good thing. We have women leaders at almost every department and all that. So I think it's really good, especially when you see people who are considered young in high positions of authority, decision making, and all that. The fact that Agakhan itself took a chance on all of us here, whether it's Dr. Ndirangu or Dr. Nabiswa, or even myself, I think that really speaks to the institutional values that they want to uphold. And also, when we talk about the impact, projects like the Innovation Center, obviously it's a donor-funded project, but the fact that it's been highly supported by Agakhan at the very highest levels of authority, I think that's a really good thing. It not just speaks about Agakhan's reputation for supporting women, but also young people to express themselves, to express their ideas, and that investment is not something that that you take very lightly. So the impact, and it's true what you said, when you educate a woman, when you promote a woman, you educate and you promote an entire society. So you can see the trickle down from unis to the nurses, to even the nurses across the nation, from myself, to the innovators in residence and the female founders that we support. I think that should not be taken lightly. Thank you, Gladys.
Okay, so even as we start winding down on this conversation, again, remember we're getting to those questions. Connecting.webinars@aku.edu is where you can send your questions to. Ladies, let me put this across to you. Looking at your journeys to where you are today, I mean, in retrospect, the challenges, the experiences, what words of inspiration or advice would you pass on to the young minds that are coming after you? Let me start off with Dr. Ndirangu.
Thanks so much, Gladys. I think for me, the first thing is everyone has a different journey, and it's important to acknowledge that. And I always say experiences of others then become points from which you can learn from and which you can sort of transfer to your own circumstances. And the reason I say that is because it's usually quite daunting if you're trying to figure out how your journey can mirror another person's journey. But I believe every journey is unique and has a way of getting you to that space. So for me, I always say the starting point is be aware of who you are. I mean, I was first and foremost Eunice before I was a mother, a wife, a girlfriend, an auntie, a sister. And the reason I say this is because sometimes it's very hard to draw a line between your role and who you are. And my mentor keeps reminding me this a lot, that you need to realize that distinction. And I'll give you a classic example. When you go on family holiday, everyone else gets rested, me I come back tired. Why? I need to know, where is people swimming costume? Have they showered? Have they eaten? It's still work. Yes, the memories are priceless, but the bottom line is still, I was still doing my role. And so understanding that you need to get some me time, some time to sort of get to understand yourself and to sort of, rejuvenate, because everyone needs to rejuvenate once in a while. The other thing for me would be thinking about how do you take the various roles within you? And again, this is an amazing lesson I've learned from my mentor. When you talk about balancing, it doesn't quite work well, because balancing infers that I have to have equal time for everything that is my role in my life. And then what happens is then you're a leader, you really can't apportion equal time. And so towards that, what I'm trying to work around, I'm not very successful, but I'm getting there, is around integration. How do I integrate my various roles so that then I don't feel like every role needs a distinction? Like, I don't know, I work out. So over the weekends, I can do Zumba with my kids. So that makes me feel I've done both my workout and at the same time being able to sort of, spend time with my kids. I think also cut yourself some slack. Honestly, we are women, we don't forgive ourselves a lot. I am so much harder on myself when I don't do what I need to do than anybody else is with me. And because of that, I have learned that I have to decide what's my definition of what my success as a leader will look like, and what does success for me as Eunice look like. Because that just makes it a lot easier for me to live through, and makes it easy for me to sort of find a balance and find a way of living day to day. And then finally, rejuvenate, find a safe space for you, interact with people who are going to, have, like for me, intellectually stimulating conversations are something I like to do. So if I'm having that with some sense of humor here and there, people who then make me reflect, people who I can kind of decompress with, for me, that would be a win. So thank you very much.
Very well said. And before I cross over to Dr. Chege and Dr. Nabiswa, there's a question here, and this one is actually to you, Njoki. Is there any innovation which can emancipate us from the affliction of misinformation and disinformation?
Okay, that's a tough question. But to the person who asked the question, I think, first of all, you might need to know that the question of misinformation and disinformation is not a very recent challenge. It has only been brought to the fore by technology, and now that we're all accessing news from mobile devices. So I think we need to, so many innovations, yeah. So there's the innovations on fact checking, and there are also people who are coming up with startups that are not only doing fact check journalism, but journalism that serves a particular constituency, such as young people and women and all that. So yes, these days you cannot run a news media organization or even a small journalism startup without having a serious fact-checking arm. So I think the issue of fact-checking is becoming very serious, and we are incorporating it with the innovators in residence, whether it is at training level or just encouraging it to be part of the storytelling process. I think that is what will save us. So to your question, do I go to your question or you'll circle back to me later?
All right, I'll circle back to you. Allow me to pose the second question to Dr. Nabiswa. Which policies or support do the panelists, I think, employers should introduce to effectively encourage women into leadership positions? Dr. Nabiswa, you say you work in a field where there are more men than women, so the leadership positions are more male-dominated. Dr. Nabiswa?
Sorry.
You're muted. Please unmute yourself.
There you go. Can you hear me now?
Yes.
Yeah. So one of the things is getting the affirmative action. I mean, if we have a certain number of slots that we believe that this number of slots should be taken care of by women, that way we ensure that we have a number of women in leadership roles. That is one of the things. But the other one is just sometimes it goes beyond policies, to be honest. I think individually as women, we just need to rise up. We shouldn't wait for policies and things. We just need to wake up and take our place. For example, right now I'm in our COVID committee where we are steering the treatment of COVID in the hospital. We are majority female. And it just happened. It's not necessarily a policy, but they just looked at the people who look like they can be able to do this based on our skill sets and based on our experience. So I think as women, we should generally just take our spots, and we should just rise up and go beyond thinking that we need help in order to achieve the things that we need to achieve. Let's just go for it.
Okay, now let me pose this to Dr. Ndirangu. You are the Dean School of Nursing and Midwifery. And there's a question here: how do you manage entrenched gender biases, especially around concerns that women will get married and possibly leave work or have children?
That's really a good question. And I guess it's one a number of us may have lived through. I think this is one of the biases I would say for this International Women's Day we need to choose to challenge. The bias that women somehow leave work because they'll get married and they'll have children. And therefore we tend to pass them on for opportunities, whether it's of leadership, capacity building, because we somehow imagine that, it's a lost investment. If I may tell you, I had 2 of my children when I was doing my PhD, and my PhD was actually sponsored by the Agakhan University. So it's not to say that I would have left, or probably have left if then the university is not doing a lot more to accommodate me as a mother, or to accommodate me while I'm pregnant, or to accommodate all the other things that come with having children. So I would say it's a challenge. It's a challenge. It's a bias we need to choose to challenge. And I would say that employers can create opportunities, and we really should not use that as an excuse, because it's not a reason, as an excuse to fail to give equal opportunities to women on the basis of the fact that they'll get married and have kids. Men will do the same, but they'll still get those chances.
Very true. Now, back to Njoki. I mean, we have said, and especially in the face of a pandemic, we cannot simply return to the world the way it was. Some things need to be done differently. Now, coupled with the experiences you've had, growing yourself to where you are today, what are those words of advice you'd like to share?
So I think I'll just draw from my personal experience, and I think women need to take more risks going forward. We have a reputation of, especially with our careers, playing it safe, being on the safe side and all that. Well, that is good. But I think with risk comes great reward and great opportunity. Well, at least it has from my experience. So I think that is the one thing that I would pass on to my fellow young leaders. And I want to preempt you. There's a question for me and Hilda, question 4, regarding mentorship. And it's great that the question has come up, because I was about to talk about mentorship.
Yes.
I think I cannot underscore enough the value of mentorship and the impact that mentorship has had on my career and on my life. I have several great mentors, 2 in specific, who just really handhold me, and I don't do any career move or any move at all without letting them know. And the benefit of having mentors who are older than you, people who have walked the journey that you want to go, is because they give you a bird's eye view. They have been there, they have seen the exam, they know the answers, so they're just telling you this is how you should go about it. So I have succeeded in everything that I asked my mentors to give me advice when I followed their advice. So I think the issue of mentorship is important. If you don't have a mentor, you are seriously missing out on a lot of things. Thank you, Gladys.
Okay. All right, and perhaps you can answer the same question, Dr. Nabiswa, as far as which is the best advice you've ever received from a mentor?
So having a mentor is definitely, like Njoki has said, it is a must. I used to be those people, those people who just stumble through life and just go through life, and you're clever enough and you finish school anyway. And then I realized I cannot rely on my so-called intelligence, because it can only reach a certain level. Sometimes sometimes in life, we need someone else's perspective. And many times, those are people who have gone through what you've gone through. So they've learned, they've made their mistakes, and now you're learning through their mistakes. You don't need to make your own mistakes in order to learn these problems, because the mentors are there. They will guide you through it so that you don't have to go through that same thing. One of the best messages that I've received from one is that I need to be the change that I want to see in the world. And I think that is essentially it. I want to be the change that I see in this world. I can't keep on giving the responsibility to politicians and, you know, God knows who around me. I need to make a little change the way I can do it in my small world, and slowly that ripple effect, like you said, a woman, you teach a woman, you teach a society. And slowly that ripple effect will just permeate through, and we will change our society one person at a time.
Excellent. And Dr. Nabiswa, now that you're still speaking, could you perhaps tell us some of the lessons you've learned to be Dr. Nabiswa today?
One is it's okay to make mistakes. The person I am now, I have it's not been an easy journey to be who I am right now. I have made mistakes, one after the other, both in my career, my different aspects of my life. And those mistakes are actually things which have now molded me to be the person I am today. So I think whoever is out there, you know, sometimes as women, we are very tough on ourselves. So like, we shouldn't have done this, I shouldn't have done this. But the truth is those mistakes actually mold you and learn from them. So that's one of the biggest lessons that I've learned through this journey of being who I am right now. And the second, like I've said, do not wait for affirmative actions and etc. Be bold. Just go out there, lean in, as Dr. Njoki said. And that book by Sheryl Sandberg is really, really nice, because it tells you that as women, we don't have to wait for things to come our way. Let's go for these things. Let us be bold, let us be active, let us be people who just decide, you know what, I can do this, and go ahead and do it. So I would say those are my main points.
Okay, now, even as we close, quick responses to this question, and I'll pose this to both Eunice and Njoki. What support do you need at Agakhan University to support your work, other projects at the university, and how can we help? What can we do for you to thrive? Njoki?
I feel like that question comes from somebody very high up over there.
Yes.
Okay, so I'd better take this chance with everything that I have. So I think I'll go first. I think mentorship is very important. We need to have a structured mentorship program at Agakhan University, linking people at different levels of the organization to the others, not just for inspiration. Do you know there's also something called reverse mentorship, where Eunice sort of pairs up with a nurse, a female nursing student, and she bounces off her ideas to see the perspective from that nursing student. So I think the issue of mentorship is actually very critical at AKU, at both, whether it is, and this is not just for female employees, but also male employees. Thank you so much, Gladys.
All right, and Eunice?
Yes, mentorship is key. I have been very lucky to have a mentor who's listening on in the call, and I think that's amazing. I think the other thing is the university needs to create an environment that is very conducive for women to grow and thrive, because then that becomes a lot easier for you to lead a team when you have a team that is very, well adjusted. And I'm really grateful for my team in Sonam for that, because they're just an amazing people to have to work with.
All right. And Dr. Nabiswa, take this last one for the team. Being born, raised, and educated in East Africa is a privilege. In what ways does your cultural heritage influence your leadership roles locally and globally?
Wow, that's a deep question.
I know, right?
Well, I do agree it's a privilege, and I only realized it's a privilege when I went to work in the less fortunate areas in this country. Working in places like Turkana made me really open my eyes. We take a lot for granted. Now, regarding my cultural heritage, one of the main things I would say about the culture, okay, my culture, Kenya is quite diverse, but one of the things is that women have a central role in guiding and mentoring the family. And so with time, now that we're getting educated, we are using that role and we are transplanting it. So now you're no longer just guiding and mentoring a family, you're actually guiding and mentoring a village, guiding and mentoring a hospital, guiding and mentoring, and we are taking that out of that context and moving out and going globally with it. So I think that's one of the things that I would say as my culture has imparted in me. The other thing is, I also think it's important for us to realize the role that women have when it comes to working together, because part of the Kenyan culture is having chamas, women working together in small groups and making a lot of change. And that has also really gone a long way in creating these microfinance trusts and creating financial opportunities for women, both locally and globally. And that's one of the things I would say our culture has really impacted a lot upon the growth of women in this country.
Very well said, Dr. Hilda Nabiswa, an Agakhan University alumna of 2017. She's also a consultant physician, internal medicine at the PCH Ogoria Hospital. Dr. Njoki Chege, Director Innovation Center at the Graduate School of Media and Communications at the Agakhan University. And of course, Dr. Eunice Ndirangu, who is the Dean School of Nursing and Midwifery at the Agakhan University, East Africa. And she's also the chairperson of the Nursing Council of Kenya. Ladies, I appreciate you and I applaud you, and of course say kudos on this International Women's Day. You have been change agents, and clearly today you have eloquently let the public know what it is that you do, and of course the support that you would need to even thrive more. Well, that brings us to the end of this Agakhan University webinar, and definitely it was focused on driving change during the pandemic and beyond, and celebrating women in leadership at the Agakhan University, East Africa. My name is Gladys Gachanja. I'm a journalist, I'm a show host, I'm a news anchor, I'm a reporter, and I love to be part of conversations that not only inform our audiences, but they also educate our audiences and give us the skill sets that we need to be a better people. As a woman, of course, as I keep saying, today is Christmas for all the women around the world. Again, I say happy International Women's Day. I was glad to be part of this, and for all that participated and for all the questions, thank you for registering and being part of this conversation. I wish you a good evening. My name is Gladys Gachanja. Take care.